Evening. Thank you for being here with us this evening. My name is Terry Freeman, and I am the new Executive Director of the Reginald F. Lewis Museum. And I am thrilled to be here at the museum, and I'm really thrilled to be here this evening as we have this most critical and timely conversation about access to COVID-19 vaccines. You know, as you have probably seen in the news daily, there have been all sorts of concerns around availability of the vaccine. But in particular, there have been access issues presented to those underserved communities. Those underserved communities are predominantly Black and Brown communities. So this evening, we're going to have an esteemed panel to talk through some of those issues around access to COVID-19 vaccines for our communities. So without further ado, let me introduce our moderator, who is Dr. Stephen B. Thomas. He is the director of the Maryland Center for Health Equity at the University of Maryland School of Public Health. One of the nation's leading scholars in the effort to eliminate racial and ethnic health disparities, Dr. Stephen B. Thomas has applied his expertise to address a variety of conditions from which minorities generally face far poorer outcomes, including cardiovascular disease, diabetes, obesity, and HIV/AIDS. He is one of the principal investigators on the Center of Excellence in Race, Ethnicity, and Health Disparities Research, funded by the National Institute for Minority Health and Health Disparities. So now I bring on to you Dr. Stephen B. Thomas. Thanks, Dr. Thomas.
Hello, Ms. Terry Freeman. It is so exciting to be here with you here on Zoom. What an amazing opportunity for us to come together. I think this may be one of the things that lasts even after we're on the other side of the pandemic, that our communities are more comfortable with, expert in using these platforms for us to come together. Imagine that. Imagine that. So, ladies and gentlemen, it's an honor and a pleasure to have this chance to speak with you today. I'm in a remote location, which is why I don't have the backgrounds I usually have, but technology is amazing. So tonight we're going to discuss access to COVID-19 vaccines for Black and Brown communities. The session is being recorded, and you're going to have an opportunity to ask questions, but we're going to open up the show with a introduction of our panel. Are Black people dying before their time? And that's a question that we have indeed been asking ourselves. And tonight we're going to have a discussion. COVID is just an opportunity to talk more broadly about the health disparities in our community. And we have one excellent set of panelists. I'm going to introduce them and have them turn their cameras on and mics on as I introduce them to the audience here this evening. We have Dr. Michelle Gourdine. Dr. Gourdine, if you'll turn your camera on and unmute yourself. She's the Chief Medical Officer and the interim director of and Senior Vice President of Population Health and Primary Care for the University of Maryland Medical System. How are you doing this evening?
I am doing well, Dr. Thomas. Good to be with you.
Indeed, and we're going to have you elaborate on your background in a little bit, but let me bring the other panelists on. Then we have Sharon Hawks with us from Reid Temple Health, the Community Initiative Director for Reid Temple Church. Ms. Sharon Hawks, how are you this evening?
Wonderful. Thank you, Dr. Thomas. Happy to be here.
Next, we have Reverend Kobe Little. He's the president of the Baltimore chapter of the NAACP. You can turn your camera on and then turn your mic on. How are you this evening, Reverend?
Good evening, Dr. Thomas, and good evening to Dr. Gourdine and to Ms. Hawks, and a special thanks to Ms. Terry Freeman and the Reginald Lewis Museum for hosting this program and inviting us to share this evening.
Absolutely, absolutely. And then we have Dr. Kendra McDowell. She's the Chief Medical Officer for the Baltimore City Health Department. Dr. McDowell, turn your camera on and unmute yourself. How are you?
I'm doing well. Nice to meet everyone, and I'm excited to be here. And thank you as well to the Reginald Lewis Museum for this invitation.
Now, you know, we're sitting here today with over 500,000 of our fellow citizens and neighbors who are no longer with us because of the COVID pandemic. Might we take just a moment of silence to reflect on all that we have lost, reflect on their memory? Just a moment. Thank you so much. Now, Reverend Little, I'm going to start with you, and I'm going to ask each of the panelists simply to think of a word as you were in that moment of silence. Think of a word that best characterizes how you are feeling at this moment during the pandemic. And I'm going to begin with Reverend Kobe Little. Reverend, what word comes to mind?
Determined. Determined to persevere in this moment. Determined to thrive in spite of those things which would sadden us and cause us to wilt. Determined to make sure that we get the information and resources to our communities that are very much needed. Determined to work with those who will work with us, and determined to hold accountable those government leaders and policymakers who are not forthright and advancing the cause of equity for all Marylanders.
Thank you so much. And Ms. Terry Freeman, if you'd help me keep track of these words as they come out. I'm just asking for one, but I know they have many, and we're going to get some of them as we open up this conversation. Let's stay in the faith ecosystem for a little bit. And Sharon Hawks, what word comes to mind?
Hopeful.
Okay.
I'm quite hopeful with what's happening now. I'm sure we're going to talk a little bit about the clinic that we're doing and all the things that are coming about with the changes in the politics and all the things that are going on to take us to a space of somewhat normalcy again. I am hopeful that we're going to come out of this, and as a community, we're going to be better for it.
Very, very good. Now we're going to go over into that medical space. Dr. Michelle Gourdine. Now, what word comes to mind for you?
I think the word that comes to mind for me might be a bit surprising, but that word is empowered. I have participated in a number of webinars, primarily focused on Black and Brown communities. And the response that I've received and that our webinars have received shows me that our community is strong, it's resilient, it is hungry for information, because we understand that information is power. And this information equips us to be able to make the best decisions for ourselves and our family. And so I believe that this today too will be an empowering event that we're having. So I'm feeling empowered.
Oh, we have some wonderful words here. And Dr. Kendra McDowell, we're going to stay in that medical public health space. You're on the front lines as the medical officer for Baltimore City Health Department. What word comes to mind for you?
Resilience really comes to mind. I think that when we look back to where we were when this pandemic started, the middle of March, and where we are now, I know that our community has been through a lot. Probably each one of us on this call has been impacted by COVID-19 in some way. And to see where we are now in regards to the vaccination, in regards to in Baltimore City, our cases and the data that's showing, optimistically that there is some improvement and there is a light at the end of the tunnel. I do think that we are resilient as a people, just historically, and also the city is resilient. And I know that we are going to make it. We're going to make it through. So yeah, resilience.
Well, you give me hope for a better day, hearing you and hearing the words that have come out for the panel. So let's open this conversation up. If I open up the newspaper today, for the past 3 news cycles, the focus has been on vaccination distribution, or should I say the unequal distribution of the vaccine. So let me start with Dr. Gourdine. When we talk about the vaccine distribution and the patterns that we're seeing, just put it in your own words as a physician. What are we looking at, and what should our audience be concerned with?
Obviously, the vaccine is really our best hope to get out of this pandemic, but the only way for us to see that light at the end of the tunnel is to make sure that people have equal access to that vaccine. And so when you think about how the vaccine has been distributed, what we are beginning to see are some patterns of inequity there, inequity in terms of access. And when you look back historically at our communities and our historical access to healthcare, that has been inequitable as well. And this is rooted in our history. There are communities that are under-resourced, that do not have equal access to employment, equal access to transportation to be able to get to where these vaccination sites are located. Typically, when the large vaccination sites are identified, they aren't necessarily located in our communities. We don't have an M&T Bank Stadium in our community. We don't have these large resources in our community, and that is reflective of the history of this country, where we have had residual effects from segregation, discrimination that we are seeing in present day. And so that means we have a lot of work to do. As healthcare providers, we need to be clear-eyed about all of that, and we need to pay attention to all of that and make extra efforts to ensure that equitable access to the vaccine, even if we have to take it out to the community and make it more accessible to people, is what we have to pay attention to, because the truth is that in terms of the burden of COVID, it is unequally distributed, and Black and Brown communities are suffering a heavier burden of hospitalization and death from COVID.
Well, thank you very much. And Dr. McDowell, you're right there on the front line. You're in the city of Baltimore. It's a city with a large African-American population that has a number of the African-American community suffering from the disease. What pattern are you seeing, and what should your audience take away from this?
Exactly as Dr. Gourdine mentioned, we are seeing disparity in regards to vaccine access and administration, who is getting vaccinated. And I think we also know that one, early on, a lot of the data that was coming out was saying that, Black and Brown community, specifically African-American community, is vaccine hesitant. And we're seeing right now that that is not the case. One, the data is showing us that that is not the case. There was a recent poll by Goucher, and we've seen increases in wanting to get vaccinated, have already been vaccinated among African Americans. And also we see that in our own community right here in Baltimore City. There are a number of churches that are vaccination sites. There's been grassroots organization around that. And along with the health department itself, in regards to the data, who is coming to the health department vaccination sites, we know that we are serving African Americans as well. And we also know through our mobile response teams, where we're going out and bringing vaccine to older adults and to individuals that may have intellectual or developmental disability and live in an independent living facility like a senior housing site. That they are, of the data that we have, 80% are African American that are served through that site. So it really is, really about the access we're seeing right now. and really switching it from this idea of vaccine hesitancy to vaccine deliberation. There are some individuals, some communities that just need to get more information about the vaccine so that they can make an informed decision. And it is really the health department's role, the city's role, our health system. We have a very rich health system in Baltimore City, in ensuring that once providing information and access to the information is provided, that we are, like Dr. Gourdine said, really going out into the community to give vaccine. And we do have some use cases. And as we move forward for the health department, our goal is to, really get into the community and reach the African American community, and also very particularly reach those individuals even within the African American community that are not connected to healthcare, that are not connected to a provider. So be that young men, be that individuals that are homebound, we are strategizing and implementing around reaching those communities as well.
Thank you.
Within the African American community.
Well, Miss Sharon Hawks, the other big jurisdiction in the state of Maryland that has a lot of people of color, Prince George's County, which is where Reid Temple has its main headquarters. And I'm looking behind you, looking at the Healthy Communities sign. What are you seeing when you read the newspaper talking about Black people are hesitant? You got that facility there. It just opened. What are you seeing?
Yeah, Dr. McDowell was absolutely correct. It's no longer, in my mind, about hesitancy as much it is as access. We have people wrapped around the building to get in for vaccines. And so the Black community is excited about this. I do believe there is some hesitancy, and I love how you spoke about the fact that we need to take that time to address that with people to get them comfortable. But this idea that they don't want the vaccine, I don't think that's true. Literally 5 minutes before I got on this call, I was taking a call from someone who's really upset about the fact that they haven't been able to get in and how they're going to make it happen for them. And I get this constantly. I have a private practice myself, and half of my days now is spent on Reid Temple's vaccine clinic, assisting with that clinic. We have partnered with Luminous Health, Doctors Community Medical Center. And when we approached them to do this vaccine clinic, with Reid Temple being one of the largest AME churches in the world, how do we bring this into the Black community? And they got on board right away. As you know, Dr. Thomas, Doctors Community Medical Center has just changed hands not too long ago. And the president over Doctors is an African-American female who actually was raised in Prince George's County. So she has a heart for the community and was very excited to partner with us. So what I'm seeing is an excitement about the vaccine. So we're taking a lot of different approaches. I can discuss that a little bit later, how to get everyone in, but there's excitement there.
So who would have imagined that a pandemic would force us to partner? I'm sure Reid Temple's been reaching out before COVID, and now they came with a smile on their face and resources. How do we keep that going on the other side of the pandemic to address the health disparities? And Reverend Little, my word is transformative, because I think I've been transformed by this pandemic. I decided not to get a haircut or shave until Black people got vaccinated. I had no idea I had all this because you could forget we're in a pandemic when you look outside at a beautiful day. And so, Reverend, you've just heard the medical professionals. You're with the NAACP, our roadmap to freedom, and now we're in the midst of this pandemic. What are you seeing? How should the audience interpret what's being printed in the newspapers?
Well, I certainly appreciate what my colleagues on the panel have contributed. I'd like to bring a little nuance to the conversation, though. Vaccine hesitancy is a real issue. It's a legitimate issue, and we're still dealing with it. That doesn't take away from the fact that there are still tens of thousands, if not hundreds of thousands, if not millions of people in the Black community who have made their mind up and do want the vaccine. And, you know, the question of equity is not a question of equal. The question of equity is a question of needs. So I'm not asking for equal distribution. I'm asking for a distribution that meets the needs in our community. And when our community is impacted in devastating ways by the health consequences of white supremacy and structural inequity, that means that we need more and we need it sooner. And we haven't seen that. And so it's incumbent upon us to be clear on the language. There's really no difference between vaccine hesitancy and vaccine deliberation, but there is a difference between equal and equity. And so we want more than equal from the state. If things were already equal, then equal would be great. But things have not been equal. There is a long, long history, as Dr. Gourdine spelled out. And let's throw some names into the pot. J. Marianne Sims, who you know, is touted as the father of gynecology, but in fact was a mad scientist who experimented and operated on Black women without their permission, without anesthesia, and without providing any true health care. And he's just the one whose name we call. But there are hundreds, if not thousands, of doctors who over the years have been guilty of malpractice. There have also been wonderful doctors from our community, doctors external to our community, who have, you know, provided healthcare that has extended our life expectancy, that has helped us to become stronger and more vibrant. And so we're grateful for this. This is not a condemnation of the medical profession, but it is to say that there are real historical reasons for hesitancy and for distrust. And the distrust is not a question of Black people or Latinx people or Native American people being inherently distrustful. It is a question of our trust being betrayed by medical institutions and by the government. And so in light of that, the government, hospitals, medical providers have an affirmative responsibility to proactively address those issues. But guess what? It's not just the historical issues, it's the contemporary issues. Yes, we know historically Black people have not been given pain management in the ways that we should have been. But even right now, there has been inequity in diagnosis and access to testing, in access to hospitalization, and the distribution of ventilators and all kinds of things. Right now, we've all seen the videos of Black medical professionals hospitalized with COVID, crying out for equitable treatment and still not receiving it. And so what we're calling on the government to do, what we're calling on the healthcare system to do, is to be honest and to be affirmatively engaged in addressing the equity issues. Don't tell us, oh yes, you know that there are historical issues and that's really unfortunate. That's not enough. We need you to own the fact that there is inequity right now and then begin to address it. We need our healthcare professionals, whether you work for the University of Maryland or you work for Johns Hopkins or MedStar or any other institution. We need you to tell the governor, stop playing politics. Let the science lead. It is politics to say Black people in Prince George's County don't want the vaccine, so we'll go somewhere else, when you already know that you don't have enough vaccines to meet the need that has already been registered. It's politics to say that Baltimore has received more vaccines than it's entitled to. Hogwash. It's just not true. And the NAACP and Black leaders on the ground, faith leaders on the ground, shouldn't be the only ones calling this out. Everyone should reject pseudoscience. Everyone should reject politics. And everyone should be calling for an accountability to science and to the needs of our people. Listen, Donald Trump was a nightmare. And he did set the tone for the COVID conversation, but he's gone. And now all of us have to be intentional about resetting the tone of this conversation. We can't have government executives, people at the highest levels, continuing to campaign when our lives are at stake.
Reverend, you have set the table for this conversation. And I'll just add one other piece of nuance, and that is how the Tuskegee syphilis study is used as the reason why Black folk don't do certain things. So let me put that in context. 40 years, 1932, 1972, did not even apologize until 1997, okay? The men in the Tuskegee study were what? Denied treatment. They used the government infrastructure to deny penicillin to them when it became available in the 1950s. They used the health department, Dr. McDowell, and said, if these men show up, don't treat them. The congressional hearings that took place after the aftermath of Tuskegee led to the Belmont Report. Those are the ethical guidelines we live by right now. Principle 1, do no harm. Principle 2, respect for autonomy. That's why you have to do informed consent. But principle 3, Reverend, is not talked about as much. The principle of justice. Those who bear the burden of research or those who bear the burden of disease should not be denied the benefit. Therefore, the takeaway lesson for us right now from the Tuskegee study is that we should do exactly what you just said. Redouble our efforts to prioritize the African American community. Redouble our efforts to bring the services to them where they live, work, play, and worship. Redouble our efforts to build ties to Reid Temple and the other faith communities. Redouble our efforts with the civil rights movement to address the social determinants of health that Dr. Gourdine talked about. Now is the time. And if we can't do it now in the midst of a pandemic, when? So you're absolutely right. I think we need to lift up our voice. We in public health, Dr. McDowell and Ms. Hawks, we lift up. Sometimes we don't want to get involved in politics. But now we have been forced to, because the public health and the medical and the science has been politicized. And the consequences of that are what we're living with now. So this floor is open. We've had opening remarks, and now any of the panelists can speak to one another before we start taking questions from the audience. So, Ms. Hawks, I see you're ready. You have a thought you want to share?
Yeah, I was as I was listening to Reverend Little, there's something I got to share with you, and this is going to come surprise to you all because I literally just spoke it out loud about 2 months ago, and it is that my grandfather was in the Tuskegee experiment. And what's interesting, as a health professional myself, there was some shame in it with my family, being from down south, feeling like it was something that they did wrong and trying to explain to them what was done to our family. So one of the reasons why I took on the Healthy Communities Initiative was because of that, and be able to say to African Americans that even with the hesitancy in my family because of what was done, I step forward and say I'm willing to take this vaccine. The treatment was held from my grandfather, right? But this treatment, I think it's a full circle that I get to take this vaccine is not going to be held from me. We had the pleasure of actually I interviewed Dr. Fauci. We were surprised we invited him to a town hall at Reid Temple. He accepted. And one of the questions I asked him was on the line with what Reverend Little was talking about. We could talk all day about all the things we want to do in the Black community, but how do we know that at the end of the day, that we won't fall into the same thing that's happened in the past where we get left behind when it comes to the vaccine? We can talk about access and different things, but we know that at the end of the day, when you have in Prince George's County at one site, everyone standing in line is white, that there's a disconnect here. And how do we prevent that? So putting him on the spot to say that, and he's talking about some of the initiatives they have to make sure the Black community doesn't get left behind. But in reality, we in the community are going to be the ones that have to do that to ensure it doesn't happen and not look to others to do it. So at Reid Temple, there was other things I put into place when we approached Luminous. Not only are you going to come into Reid Temple, but we're going to make sure that you set aside a certain amount of that vaccine to ensure that our seniors are vaccinated first, that we make sure that people who don't have access to a computer, how do we go about reaching out to them and coming up with ways to make sure that happens? Because trying to find all the ways that we don't get left behind. So they've been very amenative to the suggestions, and we've been able to really move forward and get a lot of people in the community vaccinated.
I think that's an excellent point. We are the ones we've been waiting for. And I've been encouraged by activity in the Black community in Baltimore, where some leaders got together and had a vaccine clinic over the weekend. I think more than 2,000 people were vaccinated. We're seeing that kind of activity in Prince George's and in Montgomery, and in some of the more rural counties. We're also seeing this answering the call from our community. Listen, we want to live. We want our children to live. We want our seniors to live, and we want to see tomorrow. And so part of the work is our responsibility, but it's also our responsibility to hold our government leaders accountable. It is also our responsibility. Listen, I was on a call with funders today, and I had to point out to them that all the money that they're giving away is money that was developed and created off the backs of enslaved African people. We're not begging for anything. We are holding you accountable for what we already deserve. It's the justice that Dr. Thomas spoke about. So I think it's really important that when we talk about equity, we're clear that equity is not just making sure that Black people have access to the vaccine. That's certainly an important part of it. But another part of equity is the ownership of the infrastructure, so that the next time that there is a public health crisis, we have the infrastructure, so that it's the ownership of the data. Now, all of these studies that are going on, and you know, folks feel like they're doing something great by asking Black people to participate in studies, asking Black people to participate in work groups. But then there's never any discussion about who owns the work product or who owns the data afterwards. And, you know, look, we all know that this most importantly is about life, but it's also about money. And anybody who tells you it's not about money, I had somebody tell me, oh yeah, don't worry, these vaccines are going to be safe because these drug companies aren't doing it for money. No, it's always about money. And here's the equity test. And this is the challenge for healthcare providers. This is a challenge for community leaders. Show us the money. If your hospital, if your healthcare institution says that it is advancing equity, show us the receipts. Your financial report will indicate your commitment to equity. Does it show an equitable distribution of procurement resources? It's the same thing for the state. The state keeps stumbling over this equity question. I asked this simple question: show us the numbers. Does the spending for the vaccine rollout and the coronavirus response reflect an equitable distribution of the procurement resources? At current, you know, we're being kind if we say we don't know. We don't know because we haven't been shown the documents, but I guarantee you the spending is not equitable. And if the spending isn't equitable, that means that Black people are not empowered to show up and give their best work and their best product. They ask Black people to come to stakeholder meetings and give some commentary. And two things happen. We're rushing from work and juggling all these other things and telling them what we know, but not really being able to focus on it. And then they're discounting it because they didn't have to pay for it. But then we continue to see these snafus where people show up and they say things that they shouldn't say, and they pose for photo opportunities, and our people are still being left behind. So we have to hold people accountable, not only on the things that they say, but also on how they spend the money.
So I'm looking at Dr. Gourdine and Dr. McDowell and recognizing that aren't we glad to have the NAACP here to keep pushing that boulder up the hill towards freedom? And that we need to be, as health professionals, part of that. Dr. McDowell?
Yes, I wanted to highlight, comments from Reverend Little about Black people creating the infrastructure, owning the data. And, it does speak to kind of a lot of things. And as physicians in the healthcare field, we know that it's about leadership. It's about that pipeline as well. And then also about really galvanizing our community. And you think back to, for example, the community health center model, when that came out of the, in the 40s, in the 30s and 40s, African Americans and other individuals went down to the South and said, we need to bring healthcare to our people. Healthcare is a basic right. And we also see that with the Black Panther Party in their development of community health centers in urban centers. Baltimore City is a good example of that, with People's Clinic, which did eventually close. But that is a way that we can developing leaders within our community that not are just wanting to get trained and go forward and enter institutions, but also creating their own institutions, and also looking back on like what we have accomplished, right, historically. And we have done this historically. We have built our institutions. We have prioritized what we need as a community. And we see that, again, through the work of the Black Panther Party, through the free breakfast program, through sickle cell screening, National Sickle Cell Screening came out of the work of the Black Panther Party. So you definitely speaking to that infrastructure building, and then also the economics of it. That is a layered conversation. We talk about economics and the intersection between economics and health as well. And we see that in our community, but it's right. Where is the money? And looping that back to public health, and Dr. Thomas, you mentioned about where are we going after this, right? After the pandemic. This pandemic has really showed us that public health is critical. It touches everything. And we need to advocate for funding, sustainable funding for public health at a city level, at a state level, at a national level as well. I was prior to here, I was at the CDC. That was, public health service was a part of that, responsible for the syphilis and Tuskegee experiment. So, but that is about funding, and how are we really looking at how public health impacts every aspect of our lives, and how are we advocating at multiple levels to ensure that public health perspective and equity assessments are put into place, like you said, so that funding is going to the African American community, so that also these policies and these academic research and experiments are also being led by the community, are community driven, and are sustainable and do not end when the funding source ends. So I just wanted to hit on around sustainability and where we need to move towards after the pandemic.
And Dr. Gourdine, as you're hearing this conversation and you're seeing Reid Temple partnering with one of the major hospital systems, Luminous, and you're looking at a hospital system that has made a commitment in writing to becoming an anti-racist organization, amazing. How do we make sure that the health ministries that many of our churches have all over the state have that kind of support from the local hospitals? And any other observations you want to make before we open up for questions from the audience? Dr. Gourdine?
I think it's absolutely vital, and I just want to express appreciation for all of my fellow panelists. The dialogue here has just been outstanding, and it has been deep and profound in terms of looking at health as more than just medical care. Health is about our communities. Health is about, we talked about the money, health is about investing in our communities. And And so in terms of the assets that we have in our communities, I think that part of what I have observed in my long career, and let me just say, I grew up in the segregated South. I grew up in Mississippi. And so my father was a civil rights attorney. My mother was a school teacher. I learned a great deal from them about the injustices in this world and my responsibility to play a role in correcting and resolving those injustices. And I think we all have that responsibility and we all have that role, no matter where we are, no matter what we do. I started out this dialogue with the one word of empowerment, and I want to circle back to that for a moment, because I do not think that as a community, Black people have even begun to scratch the surface of the power that we actually do have. I think that for far too long, our communities have been looked at not from an asset-based perspective, but a deficit-based perspective. Our children are not being properly educated. Education and health intersect in so many inextricable ways. The way you get access to health insurance is through jobs that provide health insurance as a benefit for the most part. If you graduate from high school and you cannot read, you do not get a college degree, you can't get a job that provides you with access to health care. Why is it that in our communities, our public education system has to be inferior? And it's been that way for decades. My mother taught me as a school teacher, because in Mississippi, she used to get the students who were labeled the difficult students, the students who used to be expelled from school. She taught 4th grade. I asked my mother recently, and she retired many years ago. She's 80 years old now. I said, are those students that you got who were the difficult students who were always expelled, did you ever send any one of them to the principal's office? And her answer was no. She never did. And I said, what was your secret? She said, children rise to the level of expectation. We can no longer accept people expecting little of our children, expecting little of our communities, expecting little of Black people, considering us to be inferior. That is the whole foundation upon which this country was built, our inferiority. That's how they justified enslaving us. That's how they justified utilizing our labor in order to enrich this country. Why am I talking about this in a session where we're talking about health? Because it is all inextricably linked. Although the legal enslavement, Jim Crow laws, redlining, segregation is now gone, that's all illegal, the mindset remains. And the mindset remains in terms of people who look at us and expect very little from us, and we respond to that in ways that are not empowering for ourselves. And it also affects how we believe ourselves to be. We have the power. And Dr. Thomas, you mentioned this before we went online, and I'm going to say this, and Reverend Little, you said this as well. We are the ones that we are looking for. There are enough of us who need to take this seriously. This pandemic should have been an eye-opener for nobody else. It should have been an eye-opener for the Black community, that we need to take charge of our communities. We need to insist upon what is our right in terms of access to health care, in terms of access to equitable education, in terms of investments in our communities that we have not had from the history of this country, which all lead to the consequences that we see today. And so you asked about the churches, you asked about the partnerships. I think that is very important. And I don't want to minimize that at all, but we've got to go beyond that. We have elected officials of our own color, of our own kind, who we need to hold accountable as well, in addition to those who are of other races and other ethnicities. Everybody has to step up to the plate. Our history is clear. Our history is clear. We need to look at it clear-eyed. We saw over the last 4 years with the leadership in the White House, which empowered certain individuals who used to keep quiet the way they felt about us, and they were loud and proud about it. Loud and proud.
Now it's out where we
now
can.
They're coming out and they're overt with it. There was a congressman yesterday who said that, he called the insurrectionists, he called them people who love this country. But he said he would have been fearful had those insurrections been Black Lives Matter protesters. How much more do we need to hear before we understand how we are viewed in this country and how we need to stand up against that? And we need to show the power that we have. We need to insist on the things that we deserve as equal Americans in this country. This is our country as much as it is anybody else's country. And until we do that, we're going to continue to have these inequities. As Reverend Little said, equity is not equality. Equity is not about me getting the equal to what you get, because the playing field is not level. We have to level the playing field. And it starts with insisting on our children receiving the education that they need. It starts with insisting that we as Black people in general accept more than the crumbs from the table of individuals who don't respect us. We must expect and we must demand respect. And with all of that will come the resources that we need in order for us to not only overcome this pandemic, but look at all the health disparities that this pandemic shone a light on. Those of us in this panel, we knew about this. It was no shock to us when we saw all of the disparate impacts of COVID, because we've been seeing the disparate impacts with high blood pressure and with heart disease and with lung disease and all of the other diseases, cancer, et cetera. We've been seeing that for decades. It was not surprising to us at all. But what are we going to do now that we have this opportunity? You know, never waste a good crisis. And with all due respect, because I lost family members of my own, I couldn't even go to their funeral. I had to go to the funeral online. You can't even go and pay your respects to family members who you lost to this horrible pandemic. And it is absolutely horrible. But there are some opportunities that we have right now where we need to step through that door, and we need to utilize our collective power that we have on the screen, and for all the individuals who are listening, to be able to demand more than what we are getting right now, because it's not enough. And it's not about a handout. People try to portray it as, oh, we're just looking for somebody to give us something. No. We're looking for what we deserve as equal Americans and citizens in this country. And so I just clearly feel very strongly about all of this. And as a healthcare professional and as a physician, I have dedicated the rest of my career. I got more days behind me than I have in front of me, but the days that I have left in front of me will be focused on justice, and will be focused on equity, and will be focused on speaking the truth. You don't have to like me. You don't have to like what I'm saying, but you will never be able to dispute what I say, because I know what I'm talking about. And this is the truth, and this is what we all need to do to move forward.
Let me say, we must be having a good time, because time is flying. And I hope that audience out there knows this is a conversation we need to have, and that this is a beginning, not an end. You've raised health and policy legislation. You've raised issues around education. And Reverend, we've got to take this moment right now to not go back to any past, but to reimagine a brand new future. And we got the power right in these squares. Now, Terry Taylor out there has been gathering questions from the audience. Let's see how many we can take before we have to close out tonight. Miss Taylor, you want to read that first question?
Sure. So first question was, when will more people be able to get the vaccine?
Okay, now who's sitting on the allocation issues in this Hollywood Squares? Let's go to Dr. McDowell. Somebody
Yeah.
from the constituency is asking, Dr. McDowell, when will we get more vaccine? When can Black people who want it get it when they're eligible? When?
Yes. So right now, in regards to when we can get more vaccine supply, I think is slowly increasing, very slowly. And what we know right now in terms of the manufacturers is in May, that there should be sufficient vaccine for every adult in the US. And when that is being said, it means that just in terms of the production. So in the space where they're making the vaccine, there should be sufficient vaccine made to vaccinate every adult in the US. But that will take some time, even after that, maybe 2 weeks to a month, before that can be distributed to a health center or a hospital or a pharmacist. But in general, I think when we look at overall, the general population from individuals that are prioritized in phase 1, 1A, 1B, 1C, and then phase 2, which we are not in yet, and then eventually probably phase 3, that should definitely be by this summer, where every individual should have access to the vaccine. And hopefully will be to a point where you can go to a trusted individual, like your doctor's office or your pharmacist or the health department or your church, and get vaccinated. So by summer.
Okay. Well, Dr. McDowell, I can't wait till there's a mobile vaccination clinic in front of one of my barbershops. That's when the brothers and sisters really know it's time to get vaccinated.
Yeah.
Terry, do we have another question, Ms. Taylor?
Yes, we have a couple, but just back on that line, another question was, first it was, can you give us contact information to sign up, volunteer, and donate? And then it was, what things are being done now by the health department? This is by the same person, so I put those together.
In terms of what's being done by the health department, as mentioned, we have vaccination sites, mobile response teams that are going out to independent living facilities. Thus far, as of today, there have been over 26 vaccination events with over 2,200 individuals vaccinated through these sites. Of the data that we do have, what's known, 80% of those are African American. Additionally, over 20,000 older adults have pre-registered for vaccine through the health department and have been referred to appointments. 17,000 first and second doses have been administered through the health department's mass vaccination site, which right now is at BCCC. We're prioritizing our older adults, 65 and plus, at that site, as well as our educators as well. We also, so that's the side of the vaccine access. How do we get vaccine to people? And that's just as of now. Again, we are planning to bring more vaccine into the community. We also are expanding our mobile response teams. Right now, there's 6 teams that are out in a week. We're ramping that up to 12 teams that will be out and vaccinating older adults that live in that housing sites, and we're moving also to homebound as well. So how are we reaching the homebound population that is connected to services, and then there's also the homebound and bedbound population that are not connected to services. So we're strategizing and implementing around how we are going to reach those. But on the other side of it, it really is around the
Dr. McDowell, I just want to say amazing, and that we need to make sure that we have a link to the audience for them to gather additional information. I can't believe how time is flying, and folks are hungry for this kind of information, and we need to use this platform more often. Imagine, Reverend, if we did this on a routine basis and people knew to tune into the show. Before we go to closing remarks, I think we're actually right there right now, and this has to be like just a thumbnail. What is your take-home message for the audience tonight? Dr. Gourdine, take-home message.
Get the vaccine. After you get the vaccine, make sure you continue to wear your mask and continue to social distance until enough people have gotten vaccinated in order for us to be safe to get rid of those masks and that social distancing.
Okay, so Black folk, are you listening? Get vaccinated, but keep the mask on, wash your hands, and stay away from crowds until Dr. Gourdine and others say, oh, it's safe. Sharon Hawks, what is the take-home message from tonight?
So the take-home message for me is for the Black community to recognize that even if they are uncomfortable with the vaccine, we have a saying down south, if you don't know something, ask somebody. And I think it's incumbent on us in the community to answer the questions. And as the Reverend said, to do it with dignity. If someone chooses or have hesitancy, don't treat them as if they're ignorant or they don't know any better. Treat them in a way that you're trying to help them to understand why this is important for us to do. So the take home is to approach each person as an individual and do what it needs to take to get them comfortable with this vaccine.
That's right.
And if they're not, be comfortable with that too as well.
Stop the shaming and listen. People have their own journey. And guess what? When they have information like we have here tonight, it helps them make their decisions.
Yeah.
Dr. McDowell, thumbnail, take-home message from tonight.
Take-home message, similar to Dr. Gourdine, we really must continue to be cautiously optimistic, remain vigilant, continue to wear our masks, continue to social distance, continue to wash our hands, and also help out a friend, help out a neighbor, help out your community in getting vaccinated. It can be difficult to navigate, completely understand that, but we can come together as a community to help our older adults or those individuals that need assistance in getting vaccine appointments.
And you can help those older citizens and others with other things of daily life.
Too.
How about spreading some kindness? There's been a lot of loss, a lot of grief. How about a pandemic of kindness and help us heal as we get through this? Reverend Little, what's the take-home message from tonight?
Well, Dr. Thomas, thank you, and thank you to Ms. Freeman and the museum for this wonderful program. I want to show some appreciation to my fellow panelists, and I want to second everything that they've said. So those are my words, but I also hear the ancestors telling us, walk together, children.
Yeah.
Okay.
We are stronger when we're united.
Yes.
We are stronger when we work together. We are stronger when we care for one another. And as we work our way through this pandemic, as we work our way to vaccination, we also have to start working now on the equity questions around recovery. It will be many years for us to recover from the pandemic. And we can start where Dr. Gourdine pointed us. We can start with education.
Yes.
We have to be demanding millions and millions and millions of dollars more for our children to help them overcome the deficit caused by the pandemic. Let us walk together in love. Thank you.
Well, let me just say, what an amazing evening. We need more conversations like this. And let's, for the audience that's out there, let's just put our hands together. The kids taught me this. That's how they do it. Let's snap, all the panelists, snap each other, give each other. Thank the panelists and the audience out there for being attentive. And if they want more, let us know. Now let's ask Miss Terry Freeman to turn her camera on and turn her microphone on and send us home. And I really want to know, Miss Freeman, what you thought about this evening.
Well, this was a fabulous program, Dr. Thomas, and I want to thank each of you all for the good information, but also the passion with which you have delivered this information. There are a couple of things in summary that I would like to leave our audience with. First, remember the words that our panelists gave us: determined, hopeful, empowered, resilient, and transformative. Second, let's think about this idea of moving from vaccine hesitancy to vaccine deliberation. Everyone should make their decisions deliberatively. No one should just jump to any type of a conclusion. Third, the message was given to us that equality and equity are different. I describe it this way: equality is sameness, equity is fairness. All we want is some fairness. We need to make sure that we hold our government accountable. So we were all happy and proud that we did what we needed to do on November 3rd, and we came out and we voted, but that was the first step. The most important step is to remain engaged and to hold your public officials, regardless of what they look like, or if they were your person or they weren't your person, they need to be held accountable to the promises that they have made. That is our civic duty and our civic responsibility. And then finally, I think what what Dr. Gourdine said was, how much more do we need to hear? What else do we need to hear? And Ms. Hawk said, you want to know what else we need to hear? Well, then you better ask somebody. So I hope that this evening we have had this incredible conversation and that people who are in the audience learned something this evening. I certainly did. And I thank each of you for your time. I hope that those of you who are on this call who are members of the Lewis will renew your membership. And if you aren't a member, we ask you to become one, because we can't provide this type of programming without some level of revenue. And we have been impacted by COVID just like everybody else has. So please consider giving to the Lewis, and we will continue to provide this type of excellent programming. Thank you all very much for being with this
Now, Ms.
evening.
Terry, before you completely send us off and let the audience know we're just 2 minutes over, I want to give my close. I'm going to look in the mirror. I'm going to say to us public health professionals and medical professionals, we need to look in the mirror. We need to, language matters. When you come into our communities talking about herd immunity in February, Dr. Gourdine, you know what the barber said to me? He said, Dr. T, what are you talking about herd? I ain't no cow. I'm not a horse. We're in Black History Month. They got documentaries on when we were treated like chattel. Why are they using that word, herd immunity? Well, then I began to explain it to them. And you know what they said back to me, Dr. McDowell? They said, well, doesn't community immunity work? Isn't it still scientifically, isn't that what you're saying, Dr. T? And I said, absolutely. Let's go to our communities for the answer. Let's not always go and tell them, oh, here's your problem. I think they have good answers for us, not just for this moment, but for the future. And with that, Ms. Freeman, or how about if Reverend Little sends us off with a prayer? How about that? Okay, Reverend Little, send us off with a prayer, brother.
Okay. Lord, we thank you for what we have seen and heard this evening. We pray now that the message will go far and wide. We present the vision, we've posted it. Send us now those who will run with it, Lord. Look over every household. Look over every Marylander. Touch our people, heal our people, encourage them, strengthen them, and give us what we need, Lord, to go forward and to do your will. Dismiss us from this meeting, but never from your presence is our prayer. Let us all say amen.
Amen. Join the
Amen.
Lewis Museum. Am I right, Ms. Freeman?
That's right. Get your membership.
Tell them where to go to sign up.
Go to lewismuseum.org. Thank you so much for your participation this evening.
Bye-bye. Wear your mask, wash your hands. Stay safe. Till the next time.
Bye, everyone.